call the honourable member for Indi.
My question is to the Minister for Health. Minister, Albury-Wodonga Health is a cross-border provider, treating patients and community in Victoria and New South Wales equally. If the proposed boundaries of Murray Primary Health Network come into existence, it will destroy years of hard work aligning and delivering an outstanding cross-border health service. Will the minister consider realigning the Murray Network boundaries to retain the current Albury-Wodonga cross-border arrangements?
I call the Honourable Minister for Health.
Thank you very much, Madam Speaker, and I thank the honourable member for her question. Just for background for members and those listening to the broadcast, the member speaks of the Medicare locals being replaced with primary health networks. The Medicare locals, despite what the Labor Party wanted you to believe, don't deliver frontline services. So the Medicare locals is a bureaucratic structure that was created, and in some cases it's worked well, and in many others, Madam Speaker, it hasn't worked well. It's failed local communities. Now, the idea of the Medicare locals was that they would try and provide a coordination effort across the primary care network, and we agree with that proposition, Madam Speaker, and we've adopted that proposition as a basis for the PHNs. The idea of the PHNs will be to take money away from Labor's bureaucratic structure and put it back into frontline services. Now, this is a concept that is foreign to Labor, both at a state and federal level, because when they were in power in New South Wales and in Queensland, they took money away from doctors and they put it into bureaucratic structures. That's what the Labor Party does. That is not what this government will do. We want to take money away from the spin doctors that Labor employs, and we want to put them back into the hands of the real doctors and nurses so that we can get the sort of health outcomes that the honourable member would want for her local community. Now, Madam Speaker, in relation to Albury-Wodonga, it may be that in the tender process, it may be, for argument's sake, that the PHNs that cover Albury and Wodonga could be adopted by or run by the same provider. That is a very possible, not a likely outcome, but we'll see how the tender process goes. But that is a possible outcome in this process. Now, that is, Madam Speaker, the objective of this government, to try and have the PHNs collaborate, but also to be able to compete competitively against each other, so that wherever possible, yes, we can keep people out of expensive hospitals, provide support in community settings, in primary care settings, and the Labor Party, of course, wanted to put money into bureaucratic structures. Under the PHNs, we will take that money away and put it back into frontline services so that we can get the better health outcomes across this country.